My name is Dr. Richard Hilsden. I'm a general surgeon, and I wanted to speak to you today about the risks of gallbladder surgery. Gallbladder surgery is one of the most common operations done in North America, and it is relatively safe. In fact, for abdominal surgery, the risks of a patient undergoing all gallbladder surgery is low. That being said, everyone needs to understand that when you're having a surgical procedure, it is never completely risk-free. In fact, anytime you're undergoing a general anesthetic, especially for what we consider cavitary surgery, abdominal or thoracic surgery, there is actually a risk of death. Although it's just a tiny risk, that risk does exist. And people who are undergoing surgery do need to understand, really, that they're taking a small risk to achieve what we think is going to be a good and strong benefit. But there are some risks that are probably important to discuss. And in gallbladder surgery, the most important risk that we need to mention is something called a common bile duct injury. Essentially, the gallbladder drains and stores bile from the liver, and the bile ducts which drain the liver into the duodenum are very closely associated with the gallbladder. So there is a risk in both laparoscopic and open surgery of having injury to that structure. And that's extremely important to understand, because the small risk of having an injury to that structure does, though, confer with it a pretty significant negative outcome when it does happen. Some of the things that can occur when you've had a bile duct injury include the fact that you need to have a reconstruction procedure from that injury. That reconstructive procedure usually will happen within a week of having the bile duct injury, and patients who have those injuries stay in hospital for up to 2 weeks. Long term, there can be narrowing of that reconstruction. There can be infections in the biliary system as a result, and you can result in having additional surgeries in the future to correct this issue. Now, that injury happens roughly about 1 in 500 to 1 in 1,000 gallbladder surgeries. Not a common injury, but definitely something that you need to be aware of. And if you're a doctor who's explaining this to patients, or you're a patient yourself, you need to understand that risk. The other risks associated with the surgery are much smaller. Things like a wound infection, might happen more frequently, but the actual impact to the patient is significantly less. So a wound infection might happen around 2% of the time. And again, that's just some drainage around the belly button usually. It can be opened up, and with some either antibiotics or just allowing it to drain is all that's required. There's a small risk of bleeding in the operation. Again, this is very low, usually around a 1% chance of having that type of outcome. Certainly, there are anesthetic risks that are hard for me to describe, and certainly your anesthesiologist can give you some more details of those as well. Those would be things like awareness in surgery, things like postoperative nausea, vomiting, those types of complications as well. In addition to those issues, the likelihood of having what we call conversion to open is roughly 1 in 20 to 1 in 50, depending on the surgeon and their experience. And that's certainly a risk, because the expectation typically when you're having gallbladder surgery is that you go home. And if you're having that type of surgery and then have to stay in hospital for a few days to recover from a big wound, then yes, that's going to be an additional risk and experience that you need to be aware of for sure. Beyond that, those are what I would consider the most common and most material risks associated with having your gallbladder removed. I certainly encourage you, if you're a patient, to discuss these with your own doctor. Their experience will differ from mine, and they will have different things that they feel are appropriate and need to emphasize. And certainly any discussion of surgical risk is never completely comprehensive. We can only discuss what time allows. The possible risks that can happen during surgery are almost unlimited, although all very rare. It's similar to like crossing the street or leaving your home. the reality is there's a number of things that could possibly happen, but we don't think of them as being that significant. And we do recognize that we take a little bit of a chance going into the unknown on our day-to-day lives. And surgery is the same way. There are definitely some risks that are hard to quantify, that are hard to discuss. And an important thing that you need to have is a good relationship with your surgeon so you can communicate your concerns and they feel comfortable also communicating the issues that are important, that they feel important to you. Thank you for listening. My name is Dr. Richard Hilsden.